Wahab from DM1 Cluster 1. And for this video, I will demonstrate the hand washing. So, the purpose of hand washing is to prevent the possible transfer of microorganisms. So now, I'm going to prepare all the things that we needed. First, the hand towel, bar soap, tissue, and stick.
Inspect hands, observing for visible soiling cuts, breaks, or cuts in the skin or cuticles. Push the long sleeve above the elbow. Don't allow the uniform to touch the sink. Adjust the water to appropriate temperature and flow. Wet elbow to hands under the running water, always keeping hands lower than elbow. Water should flow from the elbow, which is the least contaminated area, over the hands and then down to the drain. And then wash the soap and lather hand. If the bar is accidentally dropped, repeat the procedure. Return the bar soap on the soft dish without touching the dish. Wash hands thoroughly using firm circular motion and friction on the back of the hands, palms, and wrist. This process helps loosen dirt and microorganisms. Wash each finger individually, paying special attention to areas between fingers and thumbs, moving hands back and forth, clear leather if necessary. Rinse elbow down to hands completely, keeping hands lower than elbow. The water should run from the cleaner area, which is the elbow, over the hands and then down the drain. Clean fingernails carefully under the running water using the stick. Stick helps remove dirt and reduces chance of microorganisms to remain under nails. Turn off faucet with hand towel or tissue. This is necessarily to keep the clean hands from touching contaminated faucet. Dry hands with hand towel starting from the fingertips, hands, and then wrist and forearm. So the cleanest areas are now fingers and hands. So drying should progress from clean to less clean. Use hand lotion if desired and inspect hands and nails for cleanliness.
So now I'm going to perform the surgical technique or surgical hand scrub. The purpose of this is to remove all the soil or moist transferred by microorganisms from the skin. So now these are the equipments: brush, sink with faucet or running water, sterile towel, and nail cleaner.
Inspect hands for cuts in the skin and cuticles. Push long sleeve above the elbow and put mask. Turn on the faucet and adjust the temperature to the comfortably warm. Wet hands starting from the tips of the fingers to forearms, keeping hands higher than elbows. The water will drain off your elbows, flowing from cleanest area to least cleanest area. Using the stick again, Clean your fingernails individually to remove the dirt and to reduce the chance of microorganisms to remain under the nails. Apply soap to a scrub brush or open a pre-packaged scrub brush if available. This is to remove the resident bacteria from the skin surfaces. With brush on your dominant hand, using a circular motion, scrub nails, fingers, hands, arms to elbow with 10 strokes to each of the area. The using of circular motions mechanically removes microorganisms. Scrubbing the non-dominant hand first set routine, you can remember to prevent contamination. Take the scrub brush and repeat the actions on your dominant hand. Keep the hands and arms above the elbow level. Place the fingertips under running water and thoroughly rinse the fingers, hands, and the arms. Let the water flow from the area of least, which is the hand, contamination to the area of the most contamination, which is the elbow. Secure a sterile towel by grasping it on one edge, opening it at full length, making sure it does not touch your uniform. Dry each hand and arm separately. Extend one side of the towel around fingers and hands and dry in a rotating motion up to the elbow. Reverse the towel and repeat the same action on the other hand to prevent contamination of gown. Dispose the towel and turn off the faucet using a tissue.
So now, tapos na tayo sa hand washing and hand scrubbing. So, mag-proceed na tayo sa donning and removing of sterile gloves open method. The purpose of this is to enable the midwives to handle or touch sterile objects freely without contaminating them, and also to prevent transmission of potentially infected organisms from the midwife's hands to client at high risk for infection.
First thing to do is to open the package of sterile gloves. Place the package of the gloves on the clean, dry surface area. Some gloves are packed in an inner as well as the outer package. Open the outer package without contaminating the gloves or the inner package. The surface which are next to the sterile gloves must be remained sterile. Remove the inner package from the outer package. Open the package and make sure not to touch the inner surfaces. Put the first glove on your dominant hand. If the gloves are packaged so that they lie side by side, grasp the gloves for the dominant hand by its folded cuff edge with the side thumb and first fingers of the non-dominant hand. Touch only the inside of the cuff. The hands are not sterile by touching the only inside of the gloves. the nurses or midwives avoid contaminating the outside. Put the second gloves on the non-dominant hand. Pick up the other gloves with the sterile glove hand, inserting the glove finger under the cuff and holding the glove thumb close to the glove palm. This helps prevent accidental contamination of the glove by bare hands. Pull the second gloves carefully. Hold the thumb of the glove first, hands as far as possible from the palm. Then, adjust each glove so that it fits smoothly, and carefully pull the cuffs by sliding the fingers under the cuff. In this position, the glove is less likely to touch the arm and become contaminated. Remove the first glove by grasping it on its palmar surface, taking care to touch only glove to glove. This keeps the soiled part of the used gloves from touching the skin or wrist or hands. Continue to hold the inverted removed glove by fingers of the bare hand inside the cup of the second glove. Pull the second glove off to the fingers by turning it inside out. This pulls the first glove inside the second glove. The soiled part of the glove is folded to the inside to reduce the chance of transferring any microorganisms by direct contact. Dispose the used glove.